Hello and a very warm welcome to all of you. A very good afternoon. I'm Sayukta, your host for today's live from All About Skin Wellbeing Tea. And I'm sure all of you must be really good. Today we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in our lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to chemicals in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early relief. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Rajarajan Thangaraj, who is an MBBS, MD, DVL, FAM, dermatologist, dermatosurgeon, and he is a member of dermatology community of Medisage. He has many years of experience in this field. A very warm welcome to you, Dr. Rajarajan Thangaraj. Doctor, please unmute yourself. Yes, doctor. Again, a
Good
very warm
afternoon,
welcome.
ma'am. Yeah, good afternoon, and I thank you again for giving me this opportunity. And I hope everyone will find this session useful and make use of this session if at all they have any doubts regarding Urticaria.
Absolutely. We are also looking forward to it, and I'm sure this is going to be a very informative session. So, to start with, Dr. Rajarajan, if you can tell us what is urticaria?
Yeah. Urticaria, it is not a disease per se, so we don't classify Urticaria under disease, but it is actually a reaction pattern to some kind of external agent or internal agent. So it is just a reaction pattern to any external agents like environmental agents, or it can be a reaction pattern to any kind of allergen which has entered into the bloodstream. So this urticaria is characterized by the presence of wheals and angioedema, wheals with or without angioedema. So wheals, we call it they are some swellings. They are swellings which are present within the skin, which may be skin colored or which can be reddish in color, and they can be smaller size or they may be even larger than 5 to 10 centimeters also, and usually they are accompanied by itch. And sometimes the patients may or may not have angioedema along with wheals. So angioedema is nothing but the swelling which is present around the eyelids or the lips or within the tongue or even within the respiratory pathway.
Okay. So we can say most of the time it looks like a wheel or a raised bump on the skin. And as you said, it's mostly a reaction.
Yeah,
And it can be with angioedema or without angioedema.
yeah,
We'll try to understand them in detail throughout the session. But before that, doctor, if you can tell us, because it's quite common. Many of us have urticaria, but then most probably we don't realize that what we are having, what allergy or reaction is urticaria. So if you can tell us how exactly it
yeah.
looks like, I mean, how can, as a layman, we say that okay, whatever reaction we are having is urticaria, and we need to take it seriously and go and consult with a dermat.
Yeah. See, most of the individuals, they will be having like sudden onset. like immediately after consumption of any new food items, or if at all they are going into new environment, or if at all they are taking any new drugs or something like that, the patients will have like reddish lesions. So like red colored like various shaped, they can be either linear shaped, or they can be round or oval shaped swellings which are present in the skin. And they start immediately, like initially one or two will occur, followed by crops of lesions which are distributed all over the body. And most of the time it is accompanied by itch. And when the patient thinks that like she should go and consult a dermatologist, within a short span of time it gets resolved. So the patient usually comes to us and says, like before 1 or 2 hours I was having these bumps all over the skin which was reddish in color, and within a span of time it got resolved. And very rarely the patient will have like breathing disturbances or something, and sometimes it can be also accompanied by pain.
Okay. So these are like, as you said, raised bumps, red in color mostly, and it itch a lot. So itching is also a very, very prominent characteristic.
Yeah.
Now, talking about the causes of urticaria, doctor, as you said, it's more like a reaction, and we know that our body, our skin, our the whole body can react to anything. So, if we talk about the cause
Yeah.
of urticaria, how would you like to put it up?
So, talking about causes of urticaria, we can tell like which are the precipitating factors in urticaria. So, various causes are there. The first one is, I will say, in case of children, if you are taking infections, like any kind of infections, they can precipitate urticaria. Like if the patient is having sore throat, or like running nose, or any kind of viral infections like viral rhinitis, or viral pharyngitis, or if the patient is having viral diarrhea like viral gastroenteritis or something like that, they can precipitate urticaria. Most of the time, when we ask the patient about the history, if at all the child was having any fever or sore throat, or running nose, or any gastric upset in the past 1 or 2 weeks, most likely there will be positive response from the parent side. They will tell the patient was having fever and they were taking some antibiotic or something. So most likely in children, urticaria can get precipitated after any kind of infection. It can be either viral or bacterial infection. And one of the most common factor in our country, our country is being a tropical country, the worm infestation, hookworm infestation, that is the intestinal worms. So periodical deworming should be done. Those who are not doing the periodical deworming, even the worm infestation can also induce urticaria. And if the patient is having like gastric upset or ulcers, gastric ulcers for a very long period of time, it might be due to bacterial ulcer, which is because of Helicobacter pylori. And even this H. pylori infestation, and the next group of conditions are because of intake of drugs, which may be because of antibiotics, or the painkillers which we frequently take for body pain, or even for any fever illness also. If you are taking any painkiller, they can precipitate urticaria. And
Right. So the
third
bottom
thing is
line is
because of food.
yes, yes.
So most like and seafoods like fish. So even the food, even these food items like seafoods, or these legumes, peas, lentils, beans, all these things can lead to urticaria. Any food item can cause urticaria in any individual, but these are the most common etiological agents behind urticaria.
Right. So we can say, as the bottom line, that anything under the sun and even the sun can cause urticaria. So a
Yeah,
lot of
yeah.
factors can contribute or trigger
Lot
it.
of your physical agents also can lead to urticaria. So there is a separate category called physical urticaria. So where even the environmental changes in temperature, even some people they get urticaria in cold climate, some people they get urticaria in hot weather, some people they get urticaria because of wearing tight clothes. That is called like delayed pressure urticaria. And like if the patient they keep their hands over the table, or if they are holding on to some object for a longer period of time, even that can precipitate urticaria. And even after bath, if the patient is taking bath, like after hot shower or something, and once they come out, they get urticaria. So that's called aquagenic urticaria. And if the patient is having profuse sweating followed by exercise, or even after taking hot shower, due to sweating, urticaria can get precipitated. So that's called cholinergic urticaria. And like literally anything can precipitate urticaria.
Right. So anything can lead to urticaria, but the most important part states that in case you have these symptoms and signs, which the doctor have already explained to us, please go and consult the right person, which is a qualified dermatologist. Don't self-medicate. Do not go for over-the-counter medication. Do not go for various, home remedies, DIYs. Please go to the right person. We'll also talk about it. But before that, doctor, how serious can urticaria become? Is it a serious disease, a serious thing, or it's just the itching part, which is the most annoying part?
Yeah. Most of the cases we come across do not have very serious issues, but very rarely, like even I have encountered only like one or two cases. Some people with urticaria they can progress to develop angioedema and anaphylaxis. Anaphylaxis is a kind of shock where the patient will be having severe breathing difficulty, palpitation, chest pain, nasal congestion, difficulty in breathing, tremors can be there, they can have vomiting, there can be a drop in the blood pressure, there can be increase in the pulse rate or heart rate. So this is called as anaphylactic shock. So this condition warrants emergency. So the patient has to be treated as soon as possible because it is very life threatening also. So we have to intervene at the right time.
Right. So, in case it is associated with angioedema, or in case there is swelling of various parts, including the throat, etc., then it can be really dangerous. And for that, we need to go and consult the doctor. But again, previously also, if you had such symptoms or symptoms and signs associated with urticaria, please do not ignore it. Go and
Yeah.
consult your doctor. And in case you have allergy history, make your people around also aware of it. Your office
Yeah.
mates, your workplace colleagues, your family, your friends, they should know that you are allergic to these things, and if suddenly something
And
happens.
most of the time, the patients are allergic to a lot of drugs. So I always advise the patients to take a list of drugs to which they are allergic to, because like
Right.
they do not see only dermatology, they go and see various doctors, cardiologists, neurologists. So they do prescribe a lot of drugs. So sometimes when the patient is allergic to one drug, there can be cross reaction to some other drugs also. So only the doctors will be aware of those drugs which can cross react when they are giving those drugs. So the patient should always have a list of drugs whenever they visit any new doctor, so that the doctor can give the medicines accordingly.
Okay. Right. Because we are talking about urticaria, doctor, and as I said, that it is important to go and consult the right doctor, which is a qualified dermat like you. But then, because nowadays there are so many influencers on various social media platform, and skin is one of the famous trending topics. So they have these DIYs, home remedies. We are so obsessed with home remedies, applying something on the area. Then we have the over-the-counter medication thing, because it's so easily accessible, available everywhere. What is your take on that? Because it's an allergy, so the most common thing we normally do is to go take an anti-allergen, get relief, and then it just goes out of our mind. We don't go and consult a doctor and try to find out the root cause. So, what's your take on these home remedies, over-the-counter medication, etc., etc.?
See, if the urticaria is very short lasting for 2 or 3 days, and if the patient is taking home remedies, they may be happy with that. But most of the time, urticarias do not respond to home remedies. Maybe there can be a relief of symptom, there can be relief of pruritus, the itching may be getting relief for a very short period of time, but again it keeps on recurring. So luckily, like I have not seen much of the patients who are self-medicating for urticaria, but very few people they go to the over counter and get the cetirizine. They keep on taking cetirizine for a longer period of time. They get fed up with cetirizine, and finally they land up with us. So the patients who are getting into this life-threatening reactions are those people who are self-medicating. So they do not know the proper dosage. They do not know at what time they have to take the medications. They keep on self medicating it, and until they are finally getting a full blown urticaria and angioedema, and finally they come to us.
Right. So
So
as we were discussing,
urticaria also responds well to this over counter the drugs also. So
hmm,
like patients may be happy during that initial period of time, but anyhow they have to
right.
come to dermatologist.
Right, because it's important to understand what's
Yeah,
triggering urticaria in them, what is
yeah,
causing the reaction. So it's
yeah.
important to
They
understand
cannot
the root
cope up
cause,
with
and only a dermat can do that. Right.
yeah. And most of the time in this over the counters also they give only cetirizine or levocetirizine. Like other
Hmm.
drugs they do
Right.
not give. Other drugs will be prescribed only by dermatologist.
And I many times wonder that, what if a person who is a driver, say for example, he
Yeah,
have urticaria and then he goes and consult a chemist and get an anti-allergen, as you said. And there are, we know, side effects. He
yeah,
can get really sleepy and drowsy,
yeah,
etc. And it can turn out to be a life hazard. So,
yeah.
again, we don't know what we are consuming is going to help us or harm us more. So, to understand that, we need to go and consult a qualified doctor. So,
Yeah.
again,
Like
it's
most
like,
of the over-the-counter drugs, they cause dizziness, and the
hmm,
patient is not able to carry out his routine
right.
the next day.
When
Like
we go to
lot
a
of
doctor,
safer
he
drugs are
considers
available.
that how the medicine can react and etc. So that way
Yeah,
also it's way safer to go and consult with a doctor.
yeah,
Now, doctor, because we are talking about urticaria, and there are two bifurcations we normally hear of: acute urticaria, chronic urticaria. If you can shed some more light over that.
yeah. Like as you said, there are two types: acute and chronic type. Like acute urticaria, like it is having a duration lasting for less than or equal to 6 weeks. Whereas
Okay.
chronic urticaria, the patient will be having the symptoms for more than a period of 6 weeks, or sometimes, like I have seen patients who are having it for years, like even 2 years, 3 years, up to 5 years. Also, the patient came to me with urticaria. So, like based on this duration, we have two types, and acute urticaria most likely they will be having the triggers because of infections or tablet intake or food hypersensitivity. Whereas this chronic urticaria, like we have said previously, like lot of environmental factors are there. They will be causing this longer duration of urticaria, like heat urticaria, cold urticaria, pressure urticaria, and sometimes we have a term called idiopathic urticaria, in which there is no peculiar etiology is there behind the patient's urticaria. Without any etiological agent also the patient can have urticaria. And sometimes the patient will be having autoimmune disorders, underlying autoimmune disorders. They may predispose the patient to develop chronic urticaria. And sometimes other associated systemic illnesses like periodic fevers, or sometimes even the patient can have cancerous conditions. They can also predispose the patient to develop longer duration of urticaria, the chronic urticaria.
Right.
And
And
if
doctor,
you see,
Yes, yes, please continue.
Yeah. Like if you see this acute urticaria, we have inducible and non-inducible urticaria. In this inducible urticaria, like most of the causes we have told, like non-inducible urticaria, they will be spontaneous.
Hmm. Right. And how the treatment approach or line of treatment or treatment duration differs in both acute and chronic.
Like acute urticaria is usually having good prognosis. If the patient is having symptoms for a very short period, it means like patient presents to us early. Most of the time in acute urticaria, patient comes immediately. That's why we call it as acute urticaria. Whereas the chronic urticaria, patient do not present to the dermatologist early. They self-medicate for 2 or 3 months and then they finally come to dermatologist. So acute urticaria usually has good prognosis. Like if you are identifying the causative factors, like if underlying infection is treated, or if the offending agent is removed, like in case of any food items, or if they are taking any antibiotics or painkillers, and if these causative factors are avoided, then acute urticaria usually have good prognosis. But chronic urticaria, like we cannot tell exact treatment duration for individual patient. For some patient, they may get resolved within 2 weeks. For some patient, it may take up to 2 years. Also, we have to keep on changing the drugs. Also, like they may not respond to conventional antihistamine. We have to give higher immunosuppressant drugs. So, for acute urticaria, favorable prognosis, but in chronic urticaria, treatment duration usually takes longer, and both the treating doctor as well as the treatment receiving patient, both of them are dissatisfied.
Okay. Another very common question that people often ask, doctor, especially those who have chronic urticaria, is will I ever get completely cured or a permanent solution to my chronic urticaria? And as you said, you can't determine the duration, the treatment
Yeah.
duration, especially in case of chronic urticaria. It's a bit complicated in that regard. Many a times the cause is not known. Many a times the person is already coming to you after years of self medication, maybe. And
Hmm.
thus, do you have a proper answer to this question? That or is there a way to get a permanent solution to urticaria, or they need to be on medication forever, ever, and ever again?
Like instead of aiming at the permanent cure or the treatment part, we have to aim at prevention of this urticaria. Like we have to identify as much as like possible causative factor, and then we have to try avoiding those things. And the patient should be always warned of the precipitating factors. Like whenever the patient is getting infection, he should be cautious. Whenever there is environmental changes, he should be cautious. So the patient should be educated about the nature of the condition and the chronic nature of the condition in his first visit itself, so that this will avoid unnecessary anxiety to the patient. So I usually tell my patients at the first visit itself, like it will take time. It may take 1 year, it may take 2 years, or it may get resolved within 2 to 3 weeks of time. But the thing is, the patient has to continue the treatment unless until it is stopped by the doctor. Like most of the time, we continue the antihistamine for 2 to 3 months. Most of the patient they get resolved, and sometimes in the beginning of the treatment itself, we may guess the nature of the disease, like whether it will respond to the treatment or it won't respond to the treatment. So we have to initially educate the patient about the chronic nature of the disease and all the possible options of treatment. We have to tell them if it is not responding to this treatment, you may need higher levels of medications. So in first hand itself, we have to tell the patient. And even after the patient is completely freed of symptoms, he may need maintenance therapy also. Like the patient may have to take drugs once in a while, like instead of taking it daily, like weekly once, like lot of mini pulse doses of drugs are there, like weekly 1 day or weekly 2 day doses of drugs are there. He may need to maintain the tablets.
Right. Okay. Can urticaria be caused, or the effect can be increased by stress, doctor? And if yes, then how do stress urticaria looks like?
Yeah, definitely. Like lot of time, stress also can predispose to urticaria. Like most of the time, the stress can lead to release of. It can lead to increase in certain levels of chemicals called cytokines or interleukins, which are present in the blood. So all the cytokines and interleukins, they get activated during the stress, and they in turn they are going to trigger certain cells called mast cells or eosinophils, which are going to release the chemicals which are responsible for urticaria.
Okay.
So the presentation of stress urticaria is similar to other forms of urticaria.
Right. Any which way, stress is not a good thing because it can exacerbate your current urticaria.
Lot of bad chemicals which we call it cytokines or interleukins, they get increased indirectly, and they are
Mm,
going to cause urticaria.
right. And doctor, many times patients will complain that their urticaria get worse during night. So why do these hives or urticaria get worse at night?
Like like most of the time, when the patient is working during the daytime, even if the
Mm,
symptoms are there, he or she may not be aware of it. It's usually the
mm,
awareness, but when the patient is resting, or if the patient is under sleep, like he's completely in a relaxed state, so that even a smaller lesion can produce the itching sensation. It is only the difference in the awareness between the daytime and the nighttime.
okay. Because during the day we are mostly occupied, we are
Yeah, we are
preoccupied with our
occupied in
works
our
and all. Yeah.
yeah.
Okay. And doctor, does urticaria makes the patient tired as well? Because they many a times complain about fatigueness or getting tired easily.
Yeah, very rarely patient can get fatigue. Mostly urticaria patients are like even children. If you are seeing, they are very active most of the time. But
Hmm.
if the patient is having full blown urticaria, there may like urticaria has already told, the fluid component which is present within the blood, it is going and getting collected inside the skin. So it is coming out of the blood and it is entering the skin. So there may be loss of some fluid component. Then there is like some kind of dehydration which is occurring within the blood. So the
Yeah.
patient can have may feel fatigue, or they may feel dehydrated or thirsty or sometimes like that.
Right. And as we can understand urticaria, because it's so itchy, it's so annoying for the patient, and the person is continuously itching, even if the person is at home or at work, or many times patients of urticaria, they normally avoid going in public or avoid socializing because they find it very embarrassing at points because they are continuously itching. So, in that respect, also they may get tired of what and which
Hmm.
plight they are in too.
Yeah,
So, again, the bottom line remain the same. Viewers, in case you have these symptoms, please do not suffer in silence. Go out, talk about it. Go and consult a qualified dermat. Do not fall for various DIYs or over-the-counter medication. Go to the right person, a skin specialist, a qualified dermat. Now, doctor, because as we were discussing initially, that diet many a times plays a very important role, and food is one thing which many of us reacts very very quickly, whether it's
yeah,
nuts, whether it's seafoods, etc. You also mentioned plenty of food items which normally people are allergic to. Now, is
yeah.
there any dietary precautions or do's and don'ts for patients of urticaria?
Like unless until if the patient is like confirmed of having that particular food allergy, we do not advise the patient to avoid every food items, because that is in
Okay.
turn is going to have like negative impact in patient's health. If he is avoiding every food items, like he will have a drop in immunity again. which can precipitate urticaria. So if the patient is confirmed of having allergy to, for example, if the patient is having allergy to milk or milk related food items or nuts or legumes, we can ask them to avoid it for a period of like 1 month or 1.5 months. Then we can do food challenge test. Like initially we can advise them to take a very low quantity of the food, and we can observe whether the allergic reaction occurs. Even to that also, even in minimal quantities also, if the patient is developing allergy, then it is advisable to avoid that food completely, or else we can slowly challenge the patient with slowly increasing dose of that food item. Initially they can take like 50 ml of milk, then they can go to 100 ml, then 150 ml. So if you are challenging the patient slowly, the patient can get accommodated to that food item. And even the patient who was previously allergic to that food item can can continue with that after a short period of time. So food
Right.
challenge we can be done for a patient with known food allergy. Otherwise, there is no need to stop every food item.
Right. So there is no umbrella list that, there is a list and anybody or nobody should, have them in their diet. Only if you are reacting to it, only if you have allergy to it. Many times, I mean, it also happens, doctor, that maybe throughout my life I have eaten eggs and never been allergic to it.
Yeah,
And suddenly I have developed an allergy. So as you said, the doctor will check. Probably we can keep a track of it also, right? If in case we are
yeah,
getting allergic, that what we have eaten, what was our daily routine, etc. And keeping a
yeah.
track can help us to explain the doctor in detail when we go and visit the doctor. Do such kinds of tracking or noting down your daily schedules also help?
Yeah, yeah. We can note it whatever food items we are taking during a day, and uh, like uh, like if you are developing urticaria, we can observe like after how much period of time urticaria occurs. So depending on that, we can help to identify whether it is because of the breakfast or because of lunch or because of dinner it occurs. And we can take a list of food items which we have taken during that particular time. And not all the food items are going to cause urticaria. Like there are some notorious agents like food preservatives which we might have mistakenly taken, or some natural food colors which we might have taken. And some nuts or the mustard, even mustard, cashew. So there are a list of food items which are more prone to cause urticaria than every other item. So
Fair
that
enough.
if you are consulting with dermatologist can tell which is the most probable item which might have caused the reaction.
Right. And doctor, is are there any tests that you normally recommend to diagnose urticaria, or just by clinical investigation and taking history it all helps? Because now we would like to talk about diagnosis and treatment part.
Okay. So urticaria most likely it is a clinical diagnosis. There is diagnosis is by just seeing the condition and then we can diagnose it. There is nothing we can do to specifically rule out. Okay, we have done this blood test now you have got urticaria. Nothing like that. It is purely clinical diagnosis. But
Okay.
the precipitating factors we can to identify the precipitating factor, we can do certain blood tests. We can do like complete blood count, like complete hemoglobin, your white blood cell count, red blood cell count, all these things. If there is elevated white blood cell count, then we can tell the patient might have some viral infections or bacterial infection. And if the eosinophil count is getting elevated, then the patient has chance of the hookworm infestation. Then if the patient has elevated ESR or CRP, which we do routinely for most of this fever. So if ESR or CRP is elevated, patient can have underlying inflammation which is going on somewhere in the body, or the patient can have underlying malignancy. And most of the time the patient have underlying thyroid disorders also. Patient can have elevated thyroid or reduced thyroid. So we can tell the patient to do thyroid profile, particularly if the female patient is having urticaria, most likely they may have thyroid disorders. So, and if the patient is having gastric ulcer for a long period of time, then we can order them to rapid breath urease test so that we can find out whether there is H. pylori infection, whether the ulcer is because of H. pylori or it is just any other like stress ulcers or something like that. Then we can like lot of allergy panels are available, but they do not include every other agent. Like only like 30 to 40 agents will be there. We can the common allergens will be included in that allergy panel. So allergy panel we do it very last. We do not order them initially because the cost of the test is also around 20,000 to 30,000. Not everyone will do, but if the
Right.
patient is willing to do, and if you are not able to identify the etiological agent, then allergy profile can be done. Then rapid immunoassays are available. Then patch tests are available. Like the patches will be applied over the back of the patient, and we can take and the patches will be having certain allergens incorporated within them. And if the patient is allergic to certain chemicals, then the patient will have swelling in that exact areas. Like we can take the reading like after 2 days and 4 days, and then we can tell okay the patient is having allergy to this chemical or this food item. So all these things are not routinely recommended. Uh, Depending on the patient symptoms and depending on the precipitating factors and history, we can order specific investigations.
Right. We are getting so many questions. I'll try to take few of them. There is Lucky Sharma. His question is: can urticaria affect other parts of the body besides the skin?
Yeah, as already told, like urticaria affects skin, but if it is progressing to angioedema or something, then even the lips can get affected, soft tissues like your tongue, then oral mucosa can get affected, then the larynx can get affected, your vocal cord sometimes gets swollen. Because of that, even respiration becomes difficult. And if your larynx is getting affected,